Hello and welcome to Community Health Journal. Nurses and clinicians in Kadlec's birth center regularly undergo lifelike practice for complications a baby or a mom may experience during a delivery. Some of those complications can be life-threatening, so all the more reason for the team to assess their skills. We recently got to watch as nurses were put to the test.
Pop, they just wrapped her.
No, we've got a head crowning.
Oh, thick neck. So good thing Nikki's already here.
Doctor should be here soon.
Each year, nearly 3,000 babies are born at Kadlec. As a result, nurses here see virtually every kind of complication. Clinical staff regularly undergo training, on this day using lifelike mom and baby mannequins, drilling the nurse's response to scary and stressful complications that can arise during a birth.
With simulation, the nurses can perform and participate in emergencies when a patient isn't actually in harm's way, and we can become used to those procedures and work better as a team. We're going to focus on communication and working as a team with our providers and communicating amongst the nurses and how they would communicate with providers to help take care of that mom who's having an emergency.
The training on this day was made possible thanks to Lourdes Medical Center, which loaned the mannequins to Kadlec. Birth center staff are first given an overview of the problem. The simulation then begins with a nurse educator able to control the vital signs of both mom and the baby.
So we're gonna have her breathe and try not to push.
Try not to push.
The baby's coming out anyway. Thick neck, you guys ready?
In these sessions, Kadlec nurses put their skills to the test, and to a person say it all boils down to one key principle.
Communication, calling our doctors, talking to our lead, communicating with the patients and family, what's going on, because there's a lot happening and it can be really scary for especially the patient.
I noticed the communication obviously with the team, but what about the communication with the patient?
We try really hard to let them know what's going on. Even if it's something that might be scary, we try to just talk them through it so that they can know what to expect. Because it's pretty scary when 3 or 4 nurses just come rushing in and start doing things to you if you have no idea what's going on. Or even simple things like if they have meconium, it might not end up being a big deal, but I like to make sure that they know that there's going to be extra people attending their delivery. And why it might not be serious, we want to make sure that we have all the precautions necessary, and then that's why that people will be there. And that if something does go wrong, they can expect what might happen.
You just need to practice and do it over and over again and practice your communication. And
Does it get old as far as the fact that you need this training? You just always like to do, whether it's a real simulation
No,
or whether
it's always really scary. It's always a really scary situation, and you're just really thankful for your coworkers and the doctors you have to work with, and you're always really thankful when you have positive outcomes.
What an amazing place to work as far as we have new babies, and it's an incredible experience for families, and just to be there and be part of that and help make it a really good experience for them.
Even when it doesn't go according to plan.
And keep them safe even when it doesn't go according to what you think it will do.
Because of its expertise in high-risk pregnancy and its neonatal intensive care unit, Kadlec sees more instances where complications occur. Luckily, these types of deliveries do not happen very often. But when they do, the staff knows it is prepared and ready to act quickly and calmly.